Okay, good afternoon, everyone, or actually, good morning. We're still in the morning. Welcome to today's program, Graphic Medicine, Engaging Communities in Health Literacy, presented by Sarah Levin Letterer. I'm so happy that you're able to join us today. First, I am Christine Brown, and I am the Outreach Services Librarian for South Central Regional Library Council. Sarah is a public health professional with 11 years of experience working in outreach, community engagement, and health education in a variety of settings. Since 2018, Sarah has been an education and outreach coordinator with the network of the National Library of Medicine in Region 7. She has a focus on graphic medicine as well as outreach to public health partners. Partner outreach and engagement activities include overseeing grantees, teaching online and in person, and program development. Before joining NNLM R7, Sarah worked for the Philadelphia Department of Public Health on health outreach to refugee and immigrant serving organizations, homeless serving organizations, and the Free Library of Philadelphia. Coordinating the collaboration with FLP, including creating and teaching programs for patrons and staff, writing public health emergency plans that included FLP as a response partner, and managing the creation and distribution of health information bookmarks. Sarah, you can take it away.
Awesome, thank you. So as Christine said, my name is Sarah Levin Letter. My pronouns are she, her. And before I get into the sort of bulk of the presentation, I do want to upfront say that I use comics, graphic novels, comic books interchangeably in this presentation, because what we're really talking about is the idea of sequential art. So, pictures and words together to provide information, to tell a story. And so in that case, it's, and credit to Scott McCloud for that definition from sequential art. So this idea that people are still debating what the difference between a comic book and a graphic novel and a comic is. So we're not even going to worry about that. We're going to use them interchangeably, and we're always just talking about words and pictures together to tell a story. The other thing I want to mention is that there are a lot of links in this presentation. I've sent the slides to Christine so she can share them out with folks to make sure that you all have access to those links. So with that, before I get into the presentation, I did want to sort of situate who I am and where I'm coming from. One of the things is making sure that we are getting quality information, and it's important to know where that information is coming from. The NIH, the National Institutes of Health, is a 27 institutes and offices. It's a national agency. The National Library of Medicine is the world's largest biomedical library and is actually an institute of the NIH, even though it doesn't really follow that naming convention that we're used to, like the National Cancer Institute or the National Institute on Aging. The network of the National Library of Medicine is the outreach arm of the National Library of Medicine. NNLM is 7 regional medical libraries, 4 offices and centers. And then I am with the Region 7. So we are the NNLM region that covers New England and New York. So if there are any questions about this presentation, or as Christine said, my other hat is with our public health partners. So if we want to talk public health, I'm always happy to do that. Or if there are other questions, there are other folks in our office who might be able to help. So feel free to reach out. So with that, first, I want to start with the idea of learning with comics, because there is a certain amount of bias against comics in sort of a wider context. I think a lot of people hear comics and they think superhero comics, they think kids, they think sort of frivolous, but there has been some research done about how people learn with comics. And so there are sort of 4 key points. The first one being that it actually increases vocabulary. There is research showing that the pairing words with pictures increases the context clues. And so comics often have a higher rate of new vocabulary than prose-based literature. And so that also translates to introducing new concepts. With the pictures, again, you have those concept clues. And so it's easier to sort of put in context what something means, new ideas, and really getting people to engage with those ideas and taking on that information. The cause and effect structure of comics is really helpful with engaging memory. So we may not remember a statistic, but our our brains find it easier to say X happened and then Y happened, and so we can remember that X led to Y. We also have characters that we can relate to that increases a sense of empathy and really engages the audience. This person is like me. This person is not like me. Person is like somebody I know. And so it can make the story feel more safe, sort of neutral way to explore often intense and sometimes stigmatized topics. And then there's also this idea of increased engagement with materials and engaging a wider audience. If somebody says, I'm not really interested in science, they're not really likely to pick up a traditional prose book on science. But if they see something that is written as a comic, they might say, oh, well, that's an interesting format, or I really like this art. And it gets them to pick up and read the information that maybe they wouldn't have otherwise. And so a lot of this research was done on science comics, on vocabulary and reading, learning to read, but it also is transferable and translatable into how we think about learning and health information and engaging with health information with comics. So with that in mind, take it from the big idea of comics to really what is graphic medicine. Graphic medicine has actually been around for a while. Some of the earliest published examples, there was a Peanuts comic in the 60s that encouraged vaccination. There have been traditionally published graphic novels and memoirs that have dealt with health topics and themes for quite a long time. But the idea of graphic medicine as an overarching umbrella term really is only a little over 10 years old. And so it's this idea of graphic medicine being the intersection of the medium of comics and the discourse of healthcare. And so this definition was coined by Ian Williams, who is a doctor and a cartoonist. So he has written stories that are semi-autobiographical. So taking what he knows about his own experiences as a doctor and translating them into stories that people can connect with through the medium of comics. And so then it's, again, when we're talking about sequential art, it's this idea of telling stories. How do we connect people to health, stories of health, wellness, disease, and helping them to better understand those issues in a way that is approachable, that may feel safer than, again, talking or reading about things that may be hard, that may be stigmatized, things like that. So using this as a way to filter information to folks. And when we're talking about graphic medicine, there are sort of three main audiences, and those three audiences really look at it and use it in a different way. And so the first one is for providers. And so this idea of medical providers and students in those areas really using graphic medicine to think about things like building empathy. A lot of times they're only seeing patients in that very clinical setting where they have to go through a checklist, where they're doing very specific things. And so they may not be thinking about the patient as a whole person with lived experiences that are happening outside, with relationships that are happening outside of that clinical encounter. And so reading a comic, you are seeing somebody's experience as a whole person. So it's not just the clinical encounter related to their whatever health topic uh, is happening, whatever they're going through. It's how that affects their home life, how that affects their relationships, how that affects um, when they're going to work. And so getting that whole picture and then sort of keeping that in mind, because again, when you read a comic, you are working with somebody who, or you are reading about somebody and you are relating to them. You are thinking they're like me or they're like somebody I know. It's also this ability to bridge the divide between classroom knowledge and patient lived experience. Again, the difference between what you read about versus how it plays out in somebody's life. And then the third thing for providers is that comics, because of the way they're set up, a certain amount of action is happening between panels. And so that forces the reader to really think about what happened between these panels. So you got from point A to point B. Something happened, time has passed or an action has happened. And it really plays with those observational skills and that interpersonal skills of the ability to sort of think through, okay, something happened. And in a clinical encounter, that's something that is sort of missing that the provider may have to think through is the fact that sometimes people aren't able or aren't willing to give a full history. And so building those skills of, okay, if I have X information and Y information, maybe there's something in between that's important. So the second group that we really think about is patient education. And this is actually in a lot of ways patient and family education. Um, because a lot of times when we're talking about a health issue, we are also talking about the family's experience because people don't go through those things alone. And so when the patient wants to learn more information, the family often wants to learn more information as well. And so when we're thinking about graphic medicine for patient education, we are really thinking about the idea that you have a diagnosis, you're in a clinical encounter, and that's very overwhelming. If somebody says to you, I'm sorry, it's cancer, then you have a lot of questions you have to ask, but it's hard to sort of put those together. Okay, what's next? What's going on? What does that mean? All of these things, and it's very overwhelming. And so comic on the title could provide a potential concrete point of focus. Okay, this is somebody who went through something similar to what I'm going through now. What did they do? What was the information they needed? What kinds of questions did they ask? What kinds of questions did they not ask? And so then also using that concrete point of focus to think about promoting communication between patient and provider. So asking those questions, thinking about thinking things through, thinking about sort of the long term, what to expect. We can't always generalize one person's experience in a comic, but there is sort of this overarching idea of, this happened to this person. And so, can I sort of use that to think through prognosis, outcomes, treatments, all of those things. And then also, graphic medicine often is dealing with, again, things that have been potentially stigmatized. And so, this idea of reducing isolation, somebody else felt the way I feel. Somebody else um, went through what I'm going through. And so to bring that in to say, okay, I am not alone. People have done this. I can do this too. And so then the third audience that we're really thinking about is just the general public. And again, it's this idea of reducing stigma when we are introduced to something that is potentially highly stigmatized, but are then connecting it to a character, to a person. And so then again, it's that empathy. It's, I relate to this person. I know somebody who's like that. And so then it helps us bridge, what we've heard, the highly stigmatizing information with this idea of empathy. I'm following this character. I'm understanding what they're going through. I'm learning more about the disease or condition and not automatically being like, oh, those people, oh, it's like that. It's, the preconceived notions, the ability to sort of put those aside and really connect with people. And then the idea of promoting public awareness of health topics, putting out comics and getting that information out there in front of people. And then pairing that with the idea of increasing health literacy. And so, when it's back to that idea of, oh, I would never pick up a textbook about cancer or, maybe even a memoir, a traditionally written memoir about cancer, but I might pick up a comic that's about that. And so you're bringing in more people to engage with the information because they wouldn't necessarily pick up that traditionally written book, but they are intrigued by the idea of a comic. So at the beginning, I said we were talking words and pictures together and that took multiple forms. And then also to think about the fact that graphic medicine is this umbrella term. So we are talking about memoirs, we are talking about graphic nonfiction, we are talking about anthologies, we are talking about fiction. And so in this case, Kid Gloves is a memoir, but it actually also talks a lot about the history and social implications of pregnancy. So you're sort of getting that mix of memoir and then nonfiction. Graphic nonfiction, uh, and so these aren't, sorry. So that idea of graphic medicine as an umbrella term, is also encompassing these other sort of genres or of comics as well. And so to look across, when you're thinking about potential collection development or how you use these things, that, the whole gamut of this. So another part of this idea of an umbrella term is that graphic medicine can engage with a topic in multiple ways. And so you have the patient perspective, you have, the memoir of what the patient went through, how they felt, their successes, but also a lot of their frustration with the medical process. Things can also be humorous. You can sort of think about comics that have engage with a certain amount of humor, but also are giving a certain insight to something. So in this case, the webcomic by Sarah Anderson, she writes a lot about anxiety, but her webcomic is quite funny in a way that people can relate to that. Oh, something like that's happened to me. I understand what she's going through. You also provider perspective, and sometimes provider perspective and patient perspective have been put in opposition to each other, but in a lot of ways they are the opposite sides of a similar coin. Because the other thing is that we can't forget that the providers also sometimes themselves are patients, and so they have this very unique perspective on the entire process of healthcare, historical as well, and then also to think about ethics. So when we're thinking about this, again, we're thinking in those broad terms of memoir, fiction, graphic nonfiction. So a lot of the historical ones are more along the lines of graphic nonfiction, as are the ethical ones. And then one that's not pictured is also the caregiver perspective. We caregivers have a perspective that is different from the patients and is different from the providers, but also fits and serves an important role in how we think about healthcare as well. So, one more on the idea of graphic medicine is as an umbrella term. We are also talking about webcomics, self-published. This is where we get into that comic book versus graphic novel. In this case, comic books, sort of the once a month or every other week, sort of floppy issue size. And then graphic novel being the full book size. And then also to think about manga, that Japan and actually other places in the world have long histories of comic culture themselves, and they are different than what we often see here in the US. And so to include those, because we also see that a lot of people are very interested in manga. And so again, when we're thinking about how do we engage people in topics that they may not be super interested, or topics they think they may not be super interested in, using genre and medium that they are. And then the other thing to think about is that folks who haven't or don't often engage with comics, there is this misperception that it is mostly for kids. And we are talking about comics that are for all ages. So there are, teens and kids, but we also, because we're talking a lot about memoirs and memoirs written by adults for adults, we are also talking a lot about comics that are for adults. And so we do have to sometimes get over this misconception that it's all superheroes, that it's all for kids, and that it really does run for all ages. And then the other thing is with the adult comics, a lot of them aren't necessarily adult themes. It's not necessarily about the language, but a lot of times when you are thinking about a comic, there is a certain amount that is written in the images, and so how we interpret those images would change and grow as we age. We would understand more. Fun Home is a really good example. It's a great book. I know that some teens have used it to talk about LGBTQ health. And it's not for teens, but there are some very heavy literary references in there that I think if those teens go back to it when they're older, they might understand how those references to Moby Dick fit into the narrative in a way that they maybe didn't when they were teens. So it's not necessarily about bad words or bad images. It's also about how we grow and learn and be able to interpret, understand the pictures and the references that are being made. I want to talk real quick about collection development for folks who might be interested in starting their own collections. The first place to look is if you do have a comics collection already, to check your collection. For our public library partners, they often already have a comics collection, and it's just a matter of going through and seeing which titles have some kind of health, wellness, disease, healthcare focus. And that's true for their kids collection and for their adult collection. If you are looking to either start a collection or expand, graphicmedicine.org is a great resource, and they are a great resource across the board in terms of um, learning more about the books that are available, but then also learning more about graphic medicine in terms of some of the theory and practice from libraries, as well as academic and healthcare partners who have been doing this for a while. Various LibGuides, these are a few examples that have been curated and often have a point of view on them. So, for example, MCPHS, which has campuses in Boston and Worcester, actually got a grant to um, start an ebook collection because of their split campus. Their students can't necessarily always access their the physical collection that they have. And so they decided that what they really needed was to learn more about what was available in ebooks and start that. So their LibGuide, for example, does focus a certain amount on the e-resources that are available. So these four are just examples that are out there. If you are looking for other ones, it's always useful to search LibGuides plus graphic medicine. There are a whole bunch out there, and they all highlight different books because they are all thinking about their own audience when they put the guide together. And then here are two examples of graphic medicine collections that you can sort of go through and see what they have. Darien Library is a public library in Connecticut that has a graphic medicine collection, and they actually have done some work with making it very accessible by putting it separate but next to their other graphic novels. So it's curated, but for people who are interested in comics, it's right there. And so it's easy to find. And then the Countway Library is the Harvard School of Medicine's library, and they have a very extensive collection. So one of the things that our partners who have collections have really worked on and tried to figure out is ways to make sure that their patrons are finding these resources and finding these resources specifically as graphic medicine and specifically as a way to read about health topics. And so some have made it a separate collection, like I was saying with Darien. They keep it next to their graphic medicine or graphic novel collection. So folks who are interested in graphic novels, maybe perusing and they can find it right next to it, but they do keep it separate and labeled as such so that people can really see that this is a special collection that they have. Other libraries have used labels. So within their own graphic novel collection, different books may have different designations, so they may get a different label within the collection. And then there have also been some work from various partners on cataloging, so making it easier to find through curated lists that they promote, search terms and subject headings. And actually, WorldCat does have a subject heading for graphic medicine. And so it has become easier to catalog and make them easier to find in that way. So there are sort of pros and cons to different things here. One of the things to think about is that graphic medicine can expose people to things that they may not be interested in. So purely segregating the collection may keep some people from finding it if they are just browsing the graphic novels or things like that. And so it really depends on what you think is right for your audience and for your communities. But these are some ideas of working to make those titles discoverable. So once you have a collection or you have some interest in graphic medicine, what do you do with it? So a couple of programming ideas. A really uh, low bar is often just including uh, graphic medicine titles in with other displays. So a lot of libraries have displays for um, various events, various holidays, various potentially health observances. So if you're putting together a health or a display for anything, seeing if you can pull a couple of titles that would be relevant. So, an example of this would potentially be September is Preparedness Month. So, A Fire Story by Brian Fees, Drowned City by Don Brown could go on a display with some more traditionally or prose published books or handouts. Um, Healthy Aging Month. There's quite a few titles about aging, especially from the caregiver perspective. That's another one that comes in often. Cancer, mental health, they all have months, and so there are all um, there are titles for pretty much any of those health observances as well. So that's sort of on the low side or the not heavy lift side of things. In terms of other programming ideas, host, hosting workshops to talk about creating comics and really getting people into the idea of making their own comics really also helps people interpret comics as well. And so when we make comics, we really engage that part of our brain that thinks about how are we communicating with pictures, how are we communicating with words, and then once we practice that and then go and read a comic, we can sort of see um, the decisions that were made by the author, by the cartoonist, can really think critically about those things, and really also again back to the providers as an audience, this idea of how do we show action between panels without actually including an additional panel. Um, so some ideas for potentially getting people to start drawing. The other thing is that for folks who weren't necessarily considered artists as kids, we didn't necessarily continue to draw. And so really encouraging people to think about the fact that you can um, express a lot and share a lot of information, even just with stick figures, even with, it doesn't have to be great art for it to still convey information. So then one of the other things that is available and really gets into some of the things that Region 7 can do to help support this work is, so the next three slides sort of have some of the things that we can do. The first being we loan book club kits for free. It's an 8-week loan. You receive 6 copies of a book, a discussion guide, and then supporting health information. And I updated my notes, but did not update the slide. We have 13 health topics. And migrant health is missing. Oh, where it says coming soon, that one is actually now available. And I am really sorry, folks, because this list is not up to date. We have retired the AIDS and the epilepsy kit. We now have a kit that is specifically about Alzheimer's and a kit for about eating disorders that have replaced those. And then the migrant health kit is available. So we have 13 health topics. They are, for the most part, listed there. But this is a way for you to sort of try out graphic medicine with the folks that you work with, whether it's colleagues or students or the general public. And you can use these as many as often as you want. They are available to you in the region. So if you aren't necessarily thinking about graphic medicine as sort of your new thing, but do want to try to incorporate it, this is a way that you can also go. It also can serve as a try before you buy. So if you are thinking about it, but you think that there might be a hurdle in terms of getting approval for a special collection, this is something that you can take to your colleagues, to administration, and sort of have everybody try it out and see what they think in terms of um, using graphic medicine as a way to promote health literacy. So, if you are really interested in graphic medicine and are interested in learning more and engaging with folks from throughout Region 7, we do have a community of interest. COIs are support partners in emerging roles related to health information and education. COI members share ideas, knowledge, and experience to help each other improve their organization services. And so the Graphic Medicine COI meets quarterly. There is no attendance required or anything like that. But it is a good place for peer-to-peer sharing. So we've had people ask things like, does anybody have a collection development statement about their graphic medicine collection? We've had people ask about finding titles in languages other than English or Spanish. So, like, we have folks who really need titles in Portuguese. We've had people ask questions about, my library is having a graphic medicine event. Does anybody know somebody or any ideas about some programming that we might be able to do? And so it's really a great place to connect with other people, regardless of where you are in sort of your graphic medicine journey. We do have folks who have been doing this for a while, as well as folks who are either have new collections or are new to fostering their collection. The COI also is a great support for us in Region 7 to be able to reflect the needs and voices of the folks working in graphic medicine in our region. So they have helped with putting webinars together, again, with resource sharing beyond the COI. So being able to take this information out to other folks in the region, even across the network. So if you are really interested in graphic medicine, please let me know, because we would love to have you join us. And then Region 7 also offers some funding opportunities. Our CFP for this year, or for this coming year, I should say, is currently closed, but we do, this is something that comes up annually. And so if you are thinking ahead to 2025, 2026, we will open the call in 2024. So in the fall sometime should be open, but this means that there's a lot of time to talk through potential program ideas. They are small grants. So the health information outreach grants are 20,000 and they generally run 9 to 10 months. The technology ones are 10,000 and do run that full 12-month cycle. And so, if there is something graphic medicine related that you're thinking about, or if you are thinking about any kind of project that might fit into these two categories for the next year, we'd love to, talk through that with folks. So I do want to talk about a few other resources. So we've talked, what is graphic medicine, how you might put it into your collection and also introduce it to the folks that you work with. But then there are also a few other things to consider. The first being that most graphic medicine that we're talking about is traditionally published and therefore does run into the pitfalls of who is being published, who's being published, who even has the time to write and produce and get things published. And so there are a couple of resources, the Cartoonists of Color database, the Queer Cartoonist database, and the Disabled Cartoonist database that can help connect folks to cartoonists who may be having trouble, who often aren't represented in sort of that traditional published, to find their work, to find anything that may have been traditionally published, or to find webcomics, self-published material, things like that. The other nice thing about these databases is that they are linked. So, you can find folks who are working in those areas that are overlapping. And some of the cartoonists who have claimed their profile also include general geographic data or information, I shouldn't say data. So if you are looking to bring in a speaker, you are able to use this resource to find somebody who may be more local to you as well. And so to really think about potentially amplifying, bringing in those speakers, and folks who can speak to the issues, but then also can potentially speak to the issues that they are seeing in your local area. So that's the first one. I mentioned that we have folks in the CUI who are very interested in finding resources in languages other than English, to make sure that they are providing for their folks. And so Medicina Grafica and the Japan Graphic Medicine Association are two that are sister sites to graphicmedicine.org. The bibliography of German language graphic medicine was a project that is no longer being updated. So if there's new titles, unfortunately, they are not being added, but this is a resource for some of the ones that I think it's 2022 and earlier. And then again, the bande dessinée and en sciences de la santé from the Université de Montréal is it's a LibGuide from the University of Montreal, but is a good resource for finding some titles in French. And then again, I mentioned earlier when I mentioned manga, Japan has a long tradition of a comics culture that's very specific to Japan. France does as well. The bande dessinée is a very much a French equivalent, but but they do have a very long comics tradition themselves. One of the things that I mentioned earlier is that we can't always generalize one person's experience to all of the information. And I think I also mentioned in our graphic medicine kits that we include supplemental health information. So I did really quick want to touch on a couple of resources and, really explicitly make this point that it's often useful, especially when we're talking to the general public, to pair those personal stories that get us really thinking in terms of cause and effect and having empathy and relating to a character with the more traditional health information about prevention, treatment, and the other things that people need to think about to really try to provide a fuller picture of the health topic. And so to use the comics use the comics as a way to support health literacy, but also make sure that we aren't, or that we are pairing that with the trusted health information. So for the graphic medicine kits, the information is coming from Medline Plus, which is health information in plain language for National Library of Medicine. Whatever NIH institute covers the health topic. Other HHS agencies like the CDC, SAMHSA for mental health resources, and then sometimes from health associations like the American Cancer Association, the American Diabetes Association, the American Health Association. Our emergency preparedness kit has a checklist from the Red Cross. And so, pairing that information together to really make sure that we aren't unintentionally reinforcing some stereotypes, or that we're not unintentionally reinforcing one idea of what the health topic is. And then I also, sort of the last thing I wanted to mention is that there is graphic medicine that touches on a lot of things that we are seeing in the news, a lot of hot button issues, a lot of things that are important to people. And so to really keep an eye out for some of the new titles, as well as things that may be used to address some of the things that really are coming up a lot in the news or a lot in conversation, things like that. And so a couple of examples: COVID Chronicles is an anthology that was published a couple 20 what are we 2022, late 2022. So after sort of the big surge, but while we were still very much trying to figure out how COVID had changed things, COVID Chronicles is a way to talk about that. Genderqueer is the number one challenge book in the US right now, and issues around transgender, or issues around transgender health, genderqueer, LGBTQ as a whole umbrella term, are things that a lot of people are talking about. And so this is a way, again, to talk about the topic while thinking about somebody's own lived experience. Again, the ability to relate to a person. Comics for Choice, again, is another anthology. And then The Talk by Darren Bell is about talking to his Black son about interacting with the police, and the not just the physical, but also the mental health aspects of encounters like that. So, and these are just examples. There are other ones out there on similar topics. And so to think about, it's not just, it's also these sort of very acute topics as well. So I do include a book list of all of the titles, or the screenshots that I used as different examples. Some of the things that were pulled from the web as more examples, and then references, and then questions.
Thank you, Sarah. That was awesome. I primarily work with nursing, public health, and OTPT. I know that my nursing programs don't like to be associated with medical programs. They're not doctors. I did find the blog that talks about graphic medicine and nursing. Are there any graphic novels that don't talk about medicine first before nursing? That just talk
Yes,
about nursing?
that just talk about nursing. There are a few. The biggest one that comes to mind is sort of a threefer. So MK Zerwick, who is very involved with graphicmedicine.org, and is also a nurse. So she's a nurse, she's a cartoonist. Her big work is called Taking Turns. And so it's a historical perspective. It's also HIV, AIDS historical perspective, because it's about her time as early in her nursing career on the first AIDS ward in Chicago. But it really is a lot about, so it's a lot about that, the historical perspective of it all, but it is also a lot about the mental health toll of that sort of day-to-day care and the experience that is often different for nurses than it is for sort of the doctors and everything, because they are the ones who are in and out of the rooms often. They are, a little bit more of that hands-on. And so I think that there is a lot to be said for the mental health aspect of that. She was in a very specific, very stressful situation, but I think that nurses would see themselves a lot in um, that ongoing care, the mental health struggles of that, and um, some of the things that she does outside of work to address that and keep her love of nursing during that time. There is so if you do find if you find that title in WorldCat, I'm pretty how did I do that search? The subject heading nursing, and then it's comic books, comic strips, etc. But the easiest way is if you find MK's book and then find the subject heading. There are some other things in there as well.
Yeah, I found her website.
Yeah.
Do you see that expanding, graphic novels in nursing?
And there's actually that reminded me. So graphicmedicine.org has a pilot program for liaisons. So it's folks who are working in specific areas of graphic medicine. So there's a librarian liaison, there's a chaplain liaison, there's an academic, there's a doctor, and I'm pretty sure there is a nursing one as well, but because that person.
Okay, yeah, I found it. Thank you.
Okay, yeah.
Sarah, did you intend to share that screen?
Oh, I can, yeah, actually. So this is a pretty nifty resource, actually, that, if you're looking for something specific in bioethics, cartooning, chaplaincy, comic studies. Yeah, so Esther Saltzman is their nursing liaison as well. And then Meredith Lee Volmore, you also mentioned public health. She actually is with Seattle King County, and she integrates comics as health communication into the work that she does for them.
Okay, thank you, Sarah. Do we have any other questions? Okay, I don't see any in the chat. I did put in the evaluation for the link to the evaluation for today's program. So if you can complete that, we'd greatly appreciate it. And I'm not seeing any other questions. So we thank you all for being here today. Sarah, thank you very much for this very informative program. And we'll be in touch. Thank you. Bye-bye, everyone.